It is a reprieve for thousands of Kenyans at high risk of contracting the HIV virus after the Ministry of Health, in conjunction with the National AIDS and STI Control Program NASCOP, officially unveiled new HIV prevention options. The unveiling of the pre-exposure prophylaxis HIV prevention treatment PrEP and the self-testing service makes Kenya the second country in sub-Saharan Africa to adopt the treatment and the first in the world to embrace the self-testing service.
We become the first country, therefore, to launch or introduce the self-testing, and the second country in African continent after South Africa to officially roll out the PrEP in Africa.
Pre-exposure prophylaxis is an antiretroviral drug taken daily by individuals who are at a high risk of HIV infection to reduce their chances of being infected.
As we launch the self-testing today, we believe that this is going to help in reaching the over 400,000. There are 400,000 people who are living with HIV/AIDS who are out there.
For it to be effective, health providers say one has to take the drug for at least consecutive 7 days before any exposure to HIV risk, and thereafter take the PrEP pill once a day for as long as the person remains at risk of being infected. According to NASCOP, the PrEP treatment can be used by persons with multiple sex partners, discordant couples who would want to have a baby, persons prone to sexually transmitted diseases, and those who cannot convince their partners whose HIV status is unknown to use a condom during sexual intercourse.
PrEP is available for free in those facilities that we are talking about, but if you choose to buy it over the counter, it will cost you about 3,600, yes, 3,600 shillings.
Healthcare providers say the self-testing service, which is meant to encourage Kenyans to know their HIV status, should only be used as a screening test, which should be followed by a confirmation test at the nearest health facility. Doctors say an individual can use the PrEP treatment as long as they remain at risk of HIV infection, and the treatment can only be stopped after consultations with your healthcare provider. Gloria Milimu, K24, Evening Edition.